Hi everyone, I'm Claire Batkin from Your OT Tutor. Somebody recently asked me, what do I think about the fact that there's OTs out there that will pass OT students on their clinical placement, even if they're not meeting expectations or competencies, because it's easier to pass them than it is to fail them? Well, I thought I'd discuss this by answering three questions. Firstly, why does it happen? Is it such a big deal if it does happen? And what do we do to stop it from happening? So why is this happening? I think one of the reasons is that overall OTs are pretty nice people. We don't like to be the bad guy, and having to tell an OT student that they're possibly going to fail their placement and that could delay their graduation isn't nice news to be delivering. Also, even though universities offer really good support if you do have a student that's struggling on their placement, you still need to be the one to find the time and effort to implement the strategies that they suggest. And if you're already snowed under with a really busy caseload with high KPIs and complex clients, I can completely understand why it falls into the too hard basket and you just go with the easy option of passing them without a fuss. So, do we even need to worry about this in the first place? I'd say that yes, we do, because of the impact that it can have on the students, the OT profession, and our clients. Firstly, for the student, if they're already struggling on a placement where they'd have good support, what do you think they're going to find when they're a new graduate? You'll be setting them up for a struggle, stress, possible burnout, and they may even leave the profession, when what we really need to be doing is investing more time into their undergrad training. Next, if we have OT graduates that are out there delivering services that aren't up to scratch, that's not a really good impression that we want to give for our OT profession. And finally, think about it from the client perspective, or even if it was your family member or friend that was receiving services provided by that OT student that you just passed when maybe you shouldn't have, do you think you'd be happy with that? So what can we do to stop this? Well, the percentage of occupational therapy students that struggle or fail their placements is actually quite low. But whenever you're making your placement offer, you do need to keep in the back of your mind that you may need to provide the student with extra support. So if you don't have capacity within your individual caseload or within your team to provide that support if it's needed, then you need to think a bit more carefully about whether you should offer the placement in the first place. And if you're an OT manager that's expecting your OT staff to take on students, perhaps as part of your recruitment strategy, just keep in mind that you may need to give them a little bit of space in their normal clinical KPI so that they can have time to give the students the support that they need. And if you are supervising a student and you think something's not quite right, reach out to the university as soon as possible. This will give you as much time as you can to work with the student to help them pass the placement legitimately, or the university will be able to discuss some other options with you. If you'd like to find out my answers to other questions like this, then come along to my next Ask Me Anything session where I'll be talking all about student placements, or keep an eye out for the recording.